Welcome to Awakening Potential Podcast. It's a platform that's dedicated to uncovering the extraordinary within the ordinary. Join us on a journey of self-discovery, personal growth, and inspiring transformation as we dive deep into the stories and experiences of everyday individuals who've created extraordinary lives for themselves, that they've turned their lives into remarkable tales of achievement. And our mission here is to ignite your potential and empower you to reach new heights in your own life through powerful narratives, life-changing experiences, and profound insights. We aim to spark the fire of inspiration through our listeners, motivating them to take positive action and awaken their inner hero. And today I'm so grateful to be joined by Elizabeth Kipp. Um, a true luminary in the world of stress management and historical trauma management specialist. And she is sharing invaluable wisdom and her life-changing experience moments with you today. And I'm so grateful to have you here, Elizabeth. Thank you for taking your valuable time and being here with us all. Welcome.
Well, thank you so much, Karen. That was a beautiful introduction, and I love the concept of your podcast. We
Thank you.
need this. We need this in life.
Oh, thank you. I don't know about you, but I found for myself being a doormat and being a victim in the victim mentality back in the day, I didn't know how to get through it. I felt like I was in viscous and I was like swimming through this thick to get to the top just to catch my breath. And I didn't know how to do it. And I got okay, I got the chills for that one. I remember listening to a lot of audio as I was driving. I was doing 6 hours of carpooling back in the day, and I had a lot of time to and rather than wasting it, I would, start listening to self-help, self-improvement, books on tape and stuff like that. And I started listening to other people's stories, and I kept saying to myself, if they can do it, I'm not that far-fetched. I used to think I was stupid. I might do stupid things now and then, but I'm far from stupid. But I had to really shift that mindset. What was it for you? Like to get yourself out of the way and really start jumping into who you've become today to make a difference in not just your life, but other people's lives.
Yeah, I love that question. I suffered with chronic pain for 40 years, and it's physical, but I didn't realize that chronic pain is physical, mental, and emotional. You can't separate physical from emotional and spiritual. We're all this integrated being. And there were two things that changed my trajectory from that victimhood space. One was I had to surrender.
Mm,
I had to get to a point where I'm just like, you know what? I can't fight this anymore. I need help. Right. So number one, surrender, ask for help. And then, well, that's two things. And then the third thing was the help I got was in the form of a doctor named Dr. Peter Prescott, who wrote this beautiful book. He passed away in 2015, but he wrote this beautiful book, Conquer Chronic Pain and Innovative Mind Body Approach.
oh, nice.
And he had this beautiful pain management program that I went into. And the first question I heard out of his mouth in his classroom was, what are you doing to contribute to your pain?
Mm,
And, at that time in my life, I was kind of like, I can't believe you just asked that in a room full of chronic pain sufferers. Like, how could you ask that question? Because I was so imprisoned, in my own victim mentality. I was just shocked by the question, right?
mm,
But I had a few seconds to consider it. There was a little pause there between him saying something and anybody saying anything in response to that question. And I realized just about asking that question, he had the assumption in that question is that I'm actually doing something that's contributing to my pain.
right.
And that was illuminating to me. It never occurred to me that I might be doing something. It was always the pain's doing it to me. So
Mhm.
he took me in that moment from victimhood to empowerment just by the question.
Exactly. Exactly. I
Yeah.
love that. I love that. And I love the fact that you were open to it, right? And the word surrender, do you find also, because I too, I mean, I think I had a major accident. I think we shared that on one of our calls somewhere along the line. I had a major accident in Costa Rica a year ago, this month, as a matter of fact, where I went flying off a horse. I went, I, I went down to Costa Rica to sort of get away from Sarasota where I live and just start meeting people and getting out and doing what I love doing, which is horses, as you know. And I love riding on the beach. And I went flying 6 feet up in the air, landed on my butt and broke my hip, fractured my pelvis, and dislocated my back. And I was told that there's a chance that they didn't know if I was going to walk at this point or not, right? And it had surrender came up for me. And for me, it was like constant as I'm laying there in the hospital bed after surgery in Costa Rica, where I don't speak Spanish, and going through all of that. I mean, I'm surrendering to what is in the moment and what I don't have control over in my life at the moment, surrendering to. But again, it's like I surrendered back in the day with the victim. I surrendered, with every step along the way, there's a little thread of surrender. Do you find that to be true with you as well?
Oh, are you kidding?
I
Yes,
can.
I do. Because there's this, first of all, you can't ride a horse and not surrender. And you can't successfully ride a horse and not surrender. It doesn't work like that because the horse picks up on our vibe, and
Exactly.
they're such great teachers. They actually, that was probably, I think horses, because I was on them from when I was like 4 or something.
Mm.
That was probably the first experience I had of what it feels like to surrender
Yeah.
and continue to surrender. And I'm not the manager of the universe, that kind of thing. That there's that I do that we live on this planet in relationship.
Mhm.
And it's not about me and it's not about them, it's about us. It's about this and the flow. So
Exactly.
that's now my ego will try and rise up and get in the way and go, what are you talking about? Of course I'm running the show. And I have to, or just the opposite, which is like, well, nobody wants to listen to me. So right. So it's like, for me, it's kind of a daily, I start my morning with a daily practice. A kind of a spiritual practice, a little bit of movement and meditation. And it sets me up because I begin surrendering and remembering that relationship,
Mm.
right? And that connection and the flow, and that surrendering to that. Because with the history of chronic pain, I'll fight with anything. I
Right.
fought with pain for years. And the more the pain got intense, the more I fought until it was just to a point where I was like, you know what, this isn't working. Right. I
Right.
just didn't know any other option because I just didn't, nobody brought it in, and I just didn't occur to me. But yeah, the surrender thing is a huge piece.
So what was it for you, Elizabeth, that got you through those years of pain? And I'm gonna assert that there must be a level of suffering in there as well. And what was it that shifted for you? Like, what was the big aha, other than surrendering, obviously, but there was something that you must have done or experienced or thought that
Yeah,
really.
there were a few different factors. One, I had really good support around me.
Mhm.
They couldn't take my pain away per se, but they supported me and helped kind of create an environment that was as favorable as possible.
Right.
So huge, right? Huge. And my husband believed in me, and so did my boy. So, and in fact, my son is a trauma coach now. So, wow, how does that work? Right?
How cool is that? I love that.
So, and he teaches other healers how to do trauma informed healing. So it's kind of fun. So, lots of support, and also, um, I have the science background, and I I saw that the doctors had a limiting view on how they understood healing in terms of what was possible for me.
Mhm.
And because they said I'd be that way for the rest of my life. And I was kind of like, yeah, I think that you're operating in a scientific paradigm that's maybe going to shift. I'm not sure that that's an accurate model or it's not a complete model of healing. So, and I know paradigm shift. We can hang out and this is the way the world is, and then it isn't. That the world was flat, and then the world was round, and then we didn't know what plate tectonics were, and now we do. And these things make a big difference. So I was aware of all that,
Mm.
and so I realized I was going to have to look outside of the Western medical model to um, they have their view and what they bring to the table, but I was going to need to bring more to the table. What's outside of that? Well, there's all kinds of healing modalities, and
Mhm.
there's, there's higher power, God, consciousness, whatever you want to call that, is in all of it's in all of it. Consciousness is everywhere.
Right, right.
So I knew, and I'd always felt held by this, um, higher power, whatever you want to call that, the divine, the infinite. I always felt held and guided. I felt like it kind of sometimes it was like, why is it taking so long? That's just me making a judgment, right? But 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 so I had this sense of higher power, and I had this sense of there's more to this picture than I can see. And um and then I had this I had a meditation practice since about the mid 70s. So it's not as effective on medication as it is when you're not on medication, but it was still effective. It
Mhm.
still kept me kind of in the moment, staying, you know, but it really helped me to cultivate my patience.
Yes. Mhm. Right. So how did you end up, I mean, obviously the meditation supported you as well and stepping into that holistic, and I'm all about that. What really supported you overcoming all of that? Where are you at now? I guess that's the question is, where are you at now with the pain, and how do you overcome getting into that space of where you are today? Obviously one thing led to another, right?
Well, I went into Dr. Prescott's program, and I went in there with I walked in with 40 years of chronic pain and walked out 52 days later with no pain.
So what was the big shift?
And he had a 94% success rate.
Love it.
So part of it, everybody in that program was on some kind of medication, and he helped us all detox. So that's number one, was like, see if you clear the medication, because that's tends to be a block in a
Exactly.
chronic, not acute, in a chronic pain situation.
Mhm.
So that was one. He brought in movement. So he brought in Qigong. At that point, the yoga they offer, I'm a yoga teacher, but at that point, the yoga that they taught at that facility was vinyasa flow. And
Mm.
didn't have the, I didn't have the strength at that time to do that kind of, if they brought in yin yoga, I could have done that, but they did this and I couldn't, I just didn't have the strength. But he brought in a Qigong form that was very, very doable. And I learned that from him, and it was amazing how clearing that was. So that was another one of those holistic healing modalities. He
Yeah.
did adversity therapy. I had no idea I had emotional pain in there. My background was whatever's unpleasant, you just push through it.
Right.
And I lived in a kind of I lived, I survived childhood abuse and stuff like that, but it wasn't, we wouldn't dare label it like that.
Right.
I was going through it. That was not a thing, right? Um, so there was some adversity therapy that I did, and then he had this work that he did around chronic pain and mindset, and so we cleared the physical, we cleared the spiritual, we cleared the mental, and it was this full package, and one of the things that it was a facility, a recovery facility. So there were other people recovering from other things in there, and um, 80 of us, when there were 100 patients on campus, and 80 of us went to relapse school in the afternoon, and 20 of us went to pain track, and I went to pain track. And I asked my counselor, well, I'm not getting any training in relapse school. What am I going to do? And she says, well, there's an 80% relapse rate in the first year.
Mm,
And I thought, well, I'm doomed. I don't like those odds. And it's a big question mark went on in my head. And I thought, well, what's wrong with the recovery model that's the best we can do? So I vowed, with all the people that supported me through all those years, and now I'm actually seeing a problem and maybe where I can help move the needle back on that relapse rate. So
mhm.
that's why I do. I got my sea legs in my recovery, got my stability, and then I just stepped into this role.
I love it. And the role that you're in now will be in the show notes, just so everybody knows, and your contact information will be there. But just briefly, just give a little, like, what's your greatest accomplishment that brings you to where you are today?
I found my courage.
Yeah.
I found how I would never have believed it before. I found how vast the heart space truly is. I mean, it's an organ, science will say, oh, it's an organ and it's the size of your fist and whatever, but or however big it is. It's so much more than that. So I
Yeah.
I found my courage, and also it was so interesting to me. Every single twist and turn on my journey, somebody was there for me. How do you explain that? I can't.
Right.
But courage and support and acknowledging, and that gratitude of acknowledging, oh my God, I found my courage and I look at all the support I have, right? I mean, that's
Yeah.
pretty extraordinary.
Very much so. Very much so. And that's what supported me moving forward. And I'm walking today as well because of that. It just, for me, it was mind over the matter, like, okay, you're telling me this? Doesn't have to be my truth, and what can I do to move it forward, move the needle forward, as you said. And so many people think, from my experience, so many people, and coming from a nursing background especially, it has to look a certain way because this is what I was told, or this is what I am shown. And I'm like, but there's so much more. And it begins and ends with self in my world, and where can we be responsible for supporting others and moving the needle? What's your greatest lesson out of all of this? Like, what have you learned that you could shed some light on those who are maybe just beginning their journey or in their journey, but still not quite certain how to maneuver it?
Well, a couple of things are just coming in around this conversation.
Mhm.
Like I said, asking for help is just super important. Um, when we get stuck between a rock and a hard place, we tend to, that's a very isolating space, but that's in the mind.
Mhm.
It's not real. We can get help. So that's just really important. Um, Another thing that I just would like to bring to the table, because we've touched on it,
Yeah, please.
is that I don't really care what kind of healer I'm sitting in front of. We all have blinders that we look through. We have a scope of practice
Exactly.
that maybe our insurance requires us to stay in within these limitations, or maybe it's just our training.
Right.
Whatever the reason, we have a scope of practice. So when I sit in front of a healer, and I had to learn this the hard way
Mhm.
because I didn't understand the landscape. Um, I have to be very clear about what that healer has to offer and what they don't.
Exactly.
So that when I walk into a doctor's office, if I'm walking into an orthopedic, like surgeon's office, I'm not, he's going to talk about cutting and surgery. He's not going to be talking about, you know, acupuncture. Right. He's not going to be talking about meditation. And I mean, he's going to be this is his training, and that's his specialty. And so we are hurt. And he won't be talking about osteopathy either. So you
Right.
see, we have to understand this is the this is what this healer can offer me, and they can't offer anything outside of that. And if we have our expectations in line with what the healer can offer, then we've got a generative relationship. But if I'm sitting in that office and I'm asking that person to do something that they can't within their scope of practice, then we've got a problem.
Exactly.
And we've
Exactly.
got let down, and we've been let down already, and we don't want to be let down again. And then they feel let down because they can't, so it becomes this problem. So we want to be aligned with each other, right?
Absolutely. You could just said it better. As we come to a close, Elizabeth, and it's always a pleasure. Thank you, thank you, thank you for being here. Is there some words of wisdom you'd like to leave the audience with?
Sure, the greatest healer in your life lives within you. Doctors can set a bone and stitch up a wound, but they can't tell the body how to heal. That power is within you.
Absolutely.
Yeah.
Love that. Thank you so much. The lesson here, we always have a choice. So to be ordinary in an extraordinary space, choose extraordinary. Thank you for being with us today.